So guys, tell me how you all are doing. This is Dr. Shivam, and before giving you something very high yielding, would like to remind you that before quitting, just remind yourself that you didn't come this far to come only this far. So you have to do this for yourself, for nobody else, but you need to do this for yourself, because to be in the top 1%, you have to be willing to do what other 99% are doing. So what 99% aren't doing, you have to do that to come in the top 1%, because there is no place for the rest 99. You have to be in top to get the desired thing which you are dreaming of. So TB laryngitis is one of the very important topic, and there are some easy questions from that, but once you know them you will be able to answer, but without knowing it's very difficult actually and confusing. So earliest symptoms is weakness of voice, while the first sign is hyperemia of vocal cords. There is mammillated appearance of the vocal cords and mammillated appearance in the interarytenoid region with mouse nibbled appearance of the vocal cord, and granulation tissues are also present, and there is characteristic turban epiglottis which is seen, that is pseudoedema of the epiglottis. Along with that, there is marked pallor in the surrounding mucosa of the larynx. Now another MCQ is, which part of the larynx is most commonly involved in tuberculosis of the larynx? So it is the posterior part of the larynx which is most affected, as there is pooling of the cuff of the sputum from the lungs when it is cuffed out along the posterior wall, and there will be stasis of sputum over the arytenoid and interarytenoid region. So this is one of the reasons why arytenoids are getting involved first. So this was about the TB laryngitis. And another thing important is, what are the hidden areas of the larynx once you do indirect laryngoscopy? So they are asking clinical based question from your internship part also. So in your internship you get to do IL, that is indirect laryngoscopy. So what all you cannot see. So if you move from above downward, you won't be able to see the laryngeal surface of the inferior part of the epiglottis. You won't be able to see the ventricles, anterior commissure, the postcricoid region, and the subglottis. So just see the diagram. They can ask you by giving a diagram also. And this was really important, that which all is not able to see in IL. Another thing regarding larynx is its muscles, its nerve supply. These all are very important, the intrinsic and extrinsic muscle. And the very important question is sensory supply above the vocal cords and below the vocal cords. So above the vocal cords, it is internal branch of superior laryngeal nerve, while below the vocal cord it is recurrent laryngeal nerve. So there is separate video regarding the larynx, you can watch over on my channel. So this was two important topic which I wanted to tell you, and little quote in the end, that when the things go wrong, as they may sometime, when the roads you are trudging seems all uphill, when the funds are low and debts are high, and you want to smile but you have to sigh, when all is pressing you down a bit, rest is if you must, but you don't quit. Success is failure turned inside out, the silver tint on the clouds of doubt, and you can never tell how close you are. It may be near when it seems far. So stick to the fight when you are hardest hit. It's when things go wrong that you must not quit. So this is Dr. Shivam wishing you all the very best. Stay happy in life, because this is something which matters, and all the success and all the things will only matter if you are happy at the present moment. So stay happy, stay cool, stay motivated, and do whatever you want to do. Thank you.